Are you curious about peptides for fat loss? In this video, I'm going to cover the top 3 peptides that I've used for myself and for my patients and clients to help improve their body composition. So get ready. Hi, I'm Dr. Amber, and on this channel, I talk all things peptides, health optimization, hormones, wellness. So let's dive in. Here are the top 3 peptides for fat loss. The first peptide is semaglutide, or tirzepatide, which is its sister peptide. The second peptide is called CJC ipamorelin. This is actually a peptide combination, so you're getting a bonus here. And the third peptide is BPC 157, which stands for Body Protection Compound 157. So medical disclaimer, I am not your personal doctor. This is not personalized medical advice. This is for educational and informational purposes only. Really why I wanted to make this video on YouTube is it's been a highly requested topic, but a lot of people are curious about options that are available to them that really help promote weight loss, that help optimize body composition. So enjoy. Let's start with the first peptide, and I'm going to screen share so I can really walk you through the details of this peptide. Semaglutide is a GLP-1 agonist, meaning it supports this pathway. And GLP-1 really works on appetite control, right? So improved glycemic control, as you see. It helps to keep blood sugar levels low and steady. And so when glucose levels are high and elevated from the foods that we eat, high carbohydrate foods, maybe we haven't slept enough, so we're sleep deprived, GLP-1 really works on suppressing appetite. And this keeps the blood sugar level really stable and low. So this is not recommended for somebody with hypoglycemia or low blood sugar where they get dizzy and faint all the time. You can see a lot of the benefits of this peptide are weight loss. It's neuroprotective, right? So when we keep blood glucose levels low and steady, we really help the brain. We protect the brain from aging faster. We protect the kidneys from aging faster, and then the heart as well. So you have those cardiovascular benefits there too. And I really found this helpful for women's health, PCOS, fertility, right? If blood sugar is causing a wreckage of inflammation in the body, which it often does for women with PCOS, this is a potential option. So the other key piece of this peptide is that anytime you work on the appetite pathways, you are also going to affect nausea. And there are other peptides that work on appetite. One of them is called melanotan-2. That's the peptide that causes your skin, your melanin to darken, so tanning, pigmentation of your skin. There are other peptides too, but that one also has the side effect of nausea because it reduces appetite. So with this one, semaglutide, you have that side effect of nausea, GI side effects, vomiting, diarrhea, stomach pain, constipation for some people, and not everybody gets all of these side effects. There's really a way to reduce the side effects by dosing really low and slow. And again, this is not a first line treatment. There are tons of other things that we can also do for fat loss, weight loss. Prior to adding in semaglutide, we can work on actually regulating glucose with dietary choices, right? Lean protein, healthy fats, and really balanced carbohydrate, those meals that are really balanced. But semaglutide is an option for people who have not been able to lose the weight, and it does have this protective effect, right? When we are able to keep glucose steady and low, it protects really all systems of the body, including the skin, right? Because if your glucose is high and low, you're on this roller coaster all day long, you are going to age faster in your skin. You're going to have faster wrinkling and skin damage, those lipofuscin, those dark spots. And there are some problematic aspects of semaglutide as well. There's a lot of contraindications. So somebody with hypoglycemia, kidney problems, risk of allergic reactions. There's some other more obscure contraindications as well. The big concern is that it can promote muscle loss as well as fat loss. That you have to do a lot of things to preserve lean muscle mass, like eating a high protein diet. Continuing to weight train regularly is very, very important. Collagen or supplementing with additional protein or amino acids to help support the repair of that muscle mass. Tirzepatide plus, or tirzepatide, people will say that different ways, but that's how I pronounce it. It's a peptide that's very similar to semaglutide, so I'm not going to spend a ton of time on this, but it really does also work slightly better than semaglutide because it works on 2 appetite suppression pathways instead of the one GLP-1, which semaglutide works on. But it has a lot of the same effects, otherwise, a lot of the same side effects, GI side effects, and then it helps with reducing hemoglobin A1C in many people. The big thing about semaglutide and tirzepatide that I've found helpful is it reduces those cravings. The craving reduction is one of the reasons why people really struggle with weight loss. So reduces sugar cravings, alcohol cravings. It's been used for smoking cessation as well. So let's jump to our second peptide in this series of 3 peptides for fat loss. And this is really a combo peptide, right? It's 2 different peptides in one. And you'll see TaylorMade compounding on these information sheets, but they actually don't produce any of these peptides anymore. So if you go looking for them, they're not a producer. So CJC ipamorelin is really the combination of these 2 peptides that help your body's own production of growth hormone, and they act on the pituitary gland. We found that this combination together is 5 times more effective than if they're taken separately, or more effective than sermorelin, which is the older version that's been used for 20, 30 years to help with improving growth hormone levels in a more natural way. The key with this peptide is that it has to be taken fasted. So it needs to be taken before bed on an empty stomach, right? If you take it after a big pasta dinner, it's not going to work. It has to be taken fasted. This peptide does come in a what's called an oral troche form, which can be put under the tongue, and an injectable form. I have not found the oral troche form to be as effective as the injectable. And I know a lot of people are needle phobic, but this really is the most effective and the only option, I believe, for taking this peptide. Let's talk about some of the benefits. There's a lot of benefits for this one. So it can improve bone density. It can help with building lean muscle mass. Those are really pivotal for women after the age of 30 when we tend to lose muscle mass. We're fighting against our age to preserve bone and muscle. It helps. Some people notice the libido effect, but it can help with recovery, repair from injuries, or just athletic training in general. It's really good repair peptide. It can regenerate the nervous tissue, right? It can help there, strengthen some of the immune system, works on improving what we call cell efficiency. And so a lot of these are a byproduct of that. The biggest effect that I notice when I take this is improved cognition and memory. And the reason for that is quality of sleep improves, right? So when you're sleeping deeper, you're going to be feeling better during the day. You're going to repair better, your muscles are going to repair better, all tissue in your body, including your brain. So brain function is better, which is the mental clarity here. That's the first thing that most people notice is the sleep quality improves, recovery from workouts, of course. And then skin elasticity is one aspect as well. So if you're repairing, you're sleeping deeper, you're getting more of that deep delta wave sleep, which you can actually track on like a sleep tracker. If you have an Apple Watch or any sort of Oura Ring, any tracking device, you can track your deep sleep on a nightly basis. And then more week 6 is the body composition. So this is taken in cycles. This is not a peptide that you stay on forever. This combination, it's taken short term for a lot of these benefits, these repair benefits. And I like to use it after injuries. If somebody's training really hard for an Ironman, a race, some sort of athletic event, as long as this isn't banned for that, it's fine. And there are some contraindications, of course, not while pregnant or breastfeeding, some medication interactions, and then it's an injection. So anytime you take this, you could get some redness or swelling right in that area where you inject it. The other thing that people will notice is this one can cause this flushing of the face where your face gets kind of warm and red, just like you were in the sun or you were in the sauna or a hot bath. And it usually fades pretty quickly, but is one thing to note for this particular peptide combination. Where this combo comes in really helpful with something like semaglutide is it helps with the muscle mass component. We talked about how semaglutide really can affect fat loss, but you can also lose muscle. Anytime you lose weight, you never lose 100% of fat. You always lose a little bit of muscle with that. And so the CJC ipamorelin really helps here in terms of maintaining and keeping that muscle mass around as the body composition changes and we lose some of that fat. The last peptide here is BPC-157. This peptide really helps with gut health, right? So it's actually made in our human gastric juice. It's naturally produced, and it helps with tendon to tendon or tendon to bone healing, right? So it helps with connective tissue healing. Think about joint health. Anytime there's an injury, it can really help. It's been shown to decrease inflammation, help with intestinal inflammation. So any sort of GI issues where inflammation is at play, this can potentially help. Ulcers are a really big place where this is used. So you can see H. pylori is one of those situations that you can test for H. pylori on a stool panel. It's a test that I run quite frequently. If H. pylori is present and some of those virulence factors for it are also present, it could result in some stomach ulcers, which are extremely painful. Stress can also cause stomach ulcers, and so it protects the mucosal lining, this peptide, the BPC. And again, our body produces this naturally. It's produced in our human gastric juice. Often as we age, we produce less, or if we're injured, we might benefit from a little support here, but it can help with collagen synthesis and just inflammation in general and repair. I think about this as a repair peptide. And the reason I like to pair this with semaglutide and with your CJC-ipamorelin is because BPC improves the sensitivity of the growth hormone receptors. And so your body actually will respond better to the CJC-ipamorelin, but it makes that more effective. And then because there's some GI side effects with semaglutide, the BPC comes in and helps repair and protect the gut lining if there are any of those GI side effects. The caveat is sometimes BPC can cause some constipation. And so if you already trend in that direction, you may not be a good candidate for this specific peptide. It does come in a capsule form, and then it does come as an injectable. You can see that listed here, but none of this is medical advice. You'd want to work with a practitioner who can really walk through you with dosing. There's tons of different dosing protocols. And I also have a ton of information on that as well in the box below the video. See the link there and you can find out more. So those are the three peptides. We got semaglutide, we have CJC-ipamorelin, which is actually two peptides in one, and then BPC-157. We all work on a specific pathway or a specific goal that we're trying to accomplish in terms of body composition, repair, anti-aging, but really this is the optimized fat loss protocol, and there's tons of benefit to combining these three together. So these three peptides are a game changer if you have not experienced any of them before. There's lots of factors to consider if you're looking into peptide therapy. And I'm going to make a future video about the steps to getting started, how to get started with peptide therapy. That'll be released in the next few weeks. Hit the like button if you found this helpful, and subscribe for the future videos about peptides and health optimization. And definitely in the comments, share your experiences with peptides, your questions, what came up for you, have you used any of these, what was your personal experience? I would love to hear. Also, suggest any ideas for future videos, and we will take those into account and try to make videos that really help educate you and answer the questions that you have about peptides, wellness. Also, if you wanted to opt in to the free PDFs that I just walked through, I can send you copies of all of those. And that link is going to be in the description of the video. So feel free to go there. There's more information about peptides, and it'll help you get connected to a lot of the information. Feel free to click on the link in the description that has actually the 3 PDFs that I just walked through in this video. So you can get a copy of those if you're curious. And I'll see you in the next video. Till next time. If you like this video, you might also like this one right here.